right. Welcome and thank you for joining us today for our live medical weight loss roundtable. And we really appreciate everyone's interest in this important topic. So today we'll be discussing our medical weight loss program and addressing some of the common questions and concerns surrounding this approach. And so before we really delve into the details, I really want to talk about the underlying reasons of why medical weight loss is so important. We have heard about the obesity rates increasing year over year, and now currently we're at about 44% of US adults that currently are affected by this condition. I want to take a moment to just sit with that statistic. It really is representing about half of the US adult population with obesity. So it's not just a local or a national issue, it's a global epidemic. And it's directly linked to higher risk of heart disease, stroke, diabetes, and even cancer. And unfortunately, individuals struggling with their weight often feel judgment and stigma. And they are unfairly blamed for their situation, even though we know obesity is a complex and multifactorial issue influenced by genetic, environmental, biological, and even psychosocial factors. And so at Palm, our approach to obesity is rooted in empathy, understanding, and a focus on promoting health and well-being without assigning blame. And we firmly believe in addressing the underlying causes of weight-related health risks and helping individuals prevent diseases before they even occur. So today we will be specifically discussing the use of medications for weight loss in individuals with obesity. These medications, such as semaglutide, have been available on the market for years to treat diabetes. However, we've discovered that they can help and be effective for weight loss before individuals even develop diabetes. And I think it's important to take a moment to just note that repurposing of medications for different indications is not uncommon in our medical field. As a neurologist, we've seen similar examples with medications for depression, headaches, and seizures. It's the same medication to treat all three. And I think it's important to also address some of the controversy that's surrounding some of these weight loss medications really head on. And our team of Palm physicians sat down, extensively reviewed the literature and safety profiles and efficacy of these medications. And as an organization that really is committed to tackling root cause of health issues, we unanimously agreed that if we can help individuals at risk for developing diabetes, for at risk at developing heart disease or stroke, it's really our duty to do so. So to ensure the safety and efficacy of these medications, we've really developed strict criteria for determining who should be offered these treatments, how to monitor their progress, and how to facilitate their transition on and off drugs. It's really important to emphasize that our goal is not to keep individuals on these medications long-term, but to rather help them achieve sustainable weight loss and prevent that rebound weight gain after being off of medication. So I'm really excited to have with us our panelists that will help us kind of dive into our medical weight loss program, and that's Katie Chambers and Christaney Townsend. Katie Chambers is our physician assistant who works closely with Dr. Carrie Hone, who's our doctor that leads the program, and Christaney. Katie's background is in health coaching and implementing lifestyle changes and health management, and this really makes her a valuable asset to our program. And then we're also really fortunate to have Christaney Townsend, our registered dietitian with expertise in integrative and functional nutrition. She is one of the few professionals in St. Louis trained in functional nutrition. So I really thank both of you for joining us today. And so Katie and Christaney will be addressing the most common questions we receive throughout our, about our medical weight loss program and throughout while participants are on it. And I've compiled these questions from inquiries that we regularly receive from our patients. And we also encourage you to submit your own questions in the chat, and I'll try to kind of look through them throughout the program here and address them as the discussion progresses. So once again, thank you for both joining us. And I wanted to start, Christaney, we have so many different options for weight loss, not just for medical weight loss. And we know, Weight Watchers, and there's others that are locally based, and some that are even now app-based and online only. So Christaney, I'd love for you to walk us through what your general approach is, or our general approach at Palm is, for an individual who's interested in losing weight.
Yes, awesome. Well, thank you for having me here today, Sita. I'm happy to be on this panel and discuss this medical weight loss program. And that's a great question to start this discussion. So at Palm, we have individuals first meet with our navigation team, and our navigators work with you individually to understand your goals and other issues that you may want to address and discover what is really the right program for you depending on your goals. Also at Palm, we will always use a mind, body, spirit approach with our patients. So an example of this is I've been working with a patient in our balanced living program. She was having significant gut issues. She was diagnosed with IBS, irritable bowel syndrome, dealing with really high stress, but wanting to achieve weight loss. So from a holistic integrative functional standpoint, we know that the gut and brain are connected. And when we're under really high stress, one of the first places physically that this can show up is in our gut. Also, we know that high stress and poor gut health can prevent healthy weight loss. So we helped her to manage stress and have her worked with our health coaches here at Palm in doing a variety of the vitality services, and also helped her implement a specific nutrition protocol to help heal her gut and other positive lifestyle strategies as well. So after 3 months in the program, she significantly reduced her stress, healed her gut, and achieved her goal weight, which was really awesome to experience. But this is just one example, and everyone is so individualized. So at Palm, we have multiple programs that work with individuals to help achieve healthy weight loss. And our team is specialized in that initial phase to really understand what your needs are and match you to the right program.
Yeah, I think that that's a great point. And I love that, you emphasize that it's a mind, body, spirit approach, that we're not going to just look at the biological aspects and use pharmaceuticals. It's about how do we help people incorporate lifestyle and stress management. And we know how important cortisol is to individuals with excessive weight. So I'm really glad that you emphasized that. And I think that now that we want to really kind of go into the medical weight loss, and that's really what we're here to talk about, I wanted to take just a minute to talk about the biology of what these medications that we're talking about and what they do. So I'm going to share my screen one more time and share this slide that I think is really helpful to really see what we are talking about with these medications. So semaglutide is a really common example. It's the one that we use. We use other medications as well. But this is a GLP-1 analog. And what this medication is doing is it's affecting multiple systems. So in the GI tract, it's slowing down gastric emptying. And that is really going to help people feel full faster. We're going to also, in the brain, decrease appetite with the GLP-1 analog. So the GLP-1 is really the receptor that's kind of present in all these areas. In the visceral fat, which is the fat around our bellies and around our organs, which we know is a really important factor in predicting health disease and health outcome long term. And so this is going to decrease that visceral fat. The pancreas, as we know, is important for insulin secretion, and so it will be helping to regulate that. And in the liver, decreasing glucose production. So this is why some of these medications are so effective, because it's really affecting multiple areas, all involved in excessive weight or weight gain, and then obesity. So now that we've kind of understand this biology, I would love for Katie, if you think that somebody would be a good candidate for these medications, how do you know which one's the right one? How do you choose to start somebody on a medication, and which one do you choose?
Yeah, absolutely. First of all, Sita, thank you so much for having me be a part of this today. It's a great honor to be here. And just to answer your question, kind of going back to what you've mentioned before, our medical team has gotten together, spent a lot of time with the data on these medications, and set strict guidelines on who would be a good fit for these types of weight loss medications. We've based that on the published efficacy and safety data for these specific meds, and determined that this type of weight loss medication is best suited for individuals with a BMI over 30 or a BMI over 25 with comorbidities such as a high cholesterol, high blood pressure, and diabetes. So once we determine that the individual fits those criteria that we've set, we'll do a little further investigation, dive into their personal medical history, their allergies, previous medications and experiences, their goals, and then we'll also obtain a set of blood work to determine which medication would be a best fit for them. And then taking all of that in, we'd make sure that the medication we choose is both going to be effective and safe for that person.
Yeah, I think that is really important to highlight, that we're really picking people who are truly obese or overweight with additional risk factors. And if you're not familiar with BMI, you can go into Google, any search engine, and put BMI calculator and put in your height and your weight, and you'll be able to calculate your BMI. And that is a really important thing that anyone should be comfortable knowing and doing for themselves. But we're really, the category for obesity starts at a BMI of 30 or more. And then the category for overweight, as opposed to normal weight, is at 25 to 30. So, and then I would love to take a moment, Katie, and explain, if you could tell us who's not a good person, who can't take the medication.
Yeah, absolutely. So there are a few absolute contraindications when this comes to these type of medications. So that means that someone with certain conditions absolutely should not take the medication. So those would be anyone with a history of multiple endocrine neoplasia or medullary thyroid cancer. Those type of individuals definitely would not be a good fit for this med. Also, anyone who's ever taken this class of medications in the past and had a poor reaction or allergic reaction, we definitely would recommend against taking it again. We'd also caution those individuals with a history of gallstones or pancreatitis. This isn't an absolute contraindication, but it would be an individualized approach based on that person's history, what their reaction was, and that type of thing. But we would go through their medical history in those situations and determine if it would be safe or not.
Yeah, great. And so let's say we've started somebody on a medication. Christaney, what is kind of our goal for weight loss? What's too quick? What's too slow? And I think this is a good moment to kind of address that muscle mass loss, because that also has become a really important topic surrounding these medications. And so do you mind kind of going into how do we monitor those individuals, and what our goal is?
Yes, of course. So with weight loss, we know everyone wants to lose weight quickly, but we know that actually can be tough on your metabolism and your body. So the goal rate of weight loss is roughly 1 to 1.5 pounds lost per week, or no more than 1.2% of your body weight per week. And this is really important because, again, you don't want to lose weight too quickly. It can negatively impact your metabolism and increase loss of lean muscle mass. And having lean muscle mass is very important while you're losing weight to maintain that, because muscle helps to burn fat. It maintains your metabolic rate, which means you burn more calories. It maintains your strength. And it can also help prevent that rebound weight gain after you stop taking the medication. So it's really important to maintain your muscle mass. The turtle wins the race all the time. So slower weight loss, the better. As much as we want to lose weight quickly, it'll be better in the long term to go slow, and it'll keep it off long term. So to lose fat without losing muscle, you really want to ensure you're consuming adequate protein, try incorporating some resistance strength training, ensure you're eating enough, and also get enough sleep. So all of those things can help to maintain your muscle.
Yeah. And I think that with the muscle, I think people forget that because we're so wanting to lose weight quickly. And that muscle, that's where we contain the powerhouse and energy of our cells. Those are those mitochondria, those remnants of bacteria that are actually within our cells. And they are really what is, if we can promote increased muscle mass throughout this process, let alone muscle loss, we're increasing metabolism, increasing our ability. And I think that's the most important point that I find. And the second is, again, we're going to be decreasing that rebound weight gain when people come off the medication. And I think that it's really important to share this slide here that shows how this happens. So when you looked at, this was a study published in JAMA in 2021 showing semaglutide, and this has been shown with all the other medications. And so again, this is on the y-axis here, you have the change in body weight, and then on the x-axis is time. So while people were on semaglutide during the initial phases of the trials, you saw this 10% loss of body weight, which is what we want to see potentially for individuals who are obese. Then they kept some individuals on semaglutide, and then they took people off semaglutide and put them on placebo. And you can see here, this is that rebound that you're seeing where weight gain is happening when you're off of these medications. And we don't want people to be on these medications long term. We want them to be able to be on them for 6 months to a year to get to their goal weight loss, and then be able to have their lifestyle back in place with good eating habits, exercise, stress management, so then they don't have that regain of weight. And that's really when our physicians came together, we really wanted to emphasize that component. And that's why we created those frequent check-ins that we have with you, Christaney, and with you, Katie, so that we're monitoring that and supporting you and making sure that we're keeping you accountable for that weight loss. So thank you for letting me share these slides. I think it's just nice to sometimes review some of the biology and studies when we're talking about these medications. So Katie, you have somebody who you're monitoring. We talked about Christaney monitoring the weight loss. What kind of side effects are we seeing? What are you telling people when they're first starting medications? What are the common side effects? What are the things that we're monitoring to make sure that we don't need to stop somebody? And do we have to stop people if they're developing side effects? Can you go through kind of what does that process look like?
Yeah, absolutely. So what I always tell patients is that the most common side effects are going to be mostly GI stuff. So nausea, vomiting, diarrhea, constipation, abdominal pain, and bloating. Some people have complained of increased gas or reflux. So those are the most common things. Some more severe side effects that aren't nearly as common would be pancreatitis, gallstones, infections, allergic reactions, kidney injury, those type of things. If these more severe side effects occur, albeit much less likely, we most likely would recommend discontinuing the medication, but again, it would be determined on what the side effect was, how severe it was, that type of thing. But the more severe ones would make me lean more towards stopping the medication. However, if you're having the more mild side effects, the nausea, the vomiting, the diarrhea, those types of things, if they're tolerable, if they're mild, I wouldn't necessarily say we need to stop the medication. But again, it's going to be a personalized decision based on the patient's experience, if it's something that they're willing to live with, or if it's not something that's affecting their quality of life too much, then we'd have the discussion on what would be best for them. We'd also do blood work at least every 3 months. We do at the beginning to get a baseline and to check everything out. And then we would do it at least every 3 months to ensure there's no lab changes, especially kidney or liver effects. We might consider doing blood work sooner if there are those severe side effects or intolerable side effects, again, to make sure there's nothing significant going on. But so far from my experience, most people have had pretty mild side effects. Most patients report that they have side effects when they start the medication for a day or two, or with dose increase, because we typically taper someone up in terms of their dosage. Some people say they have a side effects at the beginning, but by the time they go away, I've had very few people that have not been able to tolerate the side effects, which is really great news for this.
And I don't think that we've really clarified that these are injections that we're giving individuals, at least the one that we're using commonly, and those injections are weekly. Are you seeing side effects from the actual injection? And where are you? Can you tell me a little bit about kind of what that process looks like for people?
Absolutely. So the injections are once weekly, like you mentioned. They would go into your subcutaneous fat, usually in your abdomen. And you can technically get side effects from the injection site itself, maybe a little redness or irritation. To be honest, I have not had any patients with that issue, but it is a possibility. So that's kind of the only like local reaction most people would experience. Typically, they're going to have those GI side effects that not necessarily going to happen immediately after the injection, but maybe a day or two after, sometimes even just kind of randomly. It really depends on the person of when they're going to happen. I've just noticed that most often it's the day or two after the injections or with a dose increase.
Okay. And then there's no limitations in activity. There's, anything that they can or can't do while on this medication.
Nope, you just go about your life.
All right. All right. So one other question that I have for you, Katie, is, we know that nutrition and fitness is important. We're going to be incorporating that. Kind of outside of fitness and nutrition, what are the things that you emphasize for individuals who are getting on medication for really that long-term success?
Yeah. So there's lots of things that can affect someone's ability to lose weight and keep it off outside of just nutrition and fitness. Things, just to name a few, like stress, sleep, toxin exposure, relationship with food, your gut health, your microbiome, among many other things. Those types of things contribute to not only weight gain over time, but also your ability to lose weight and keep it off. So I think it's really important that we identify those type of contributing factors for each patient, so we can help those people overcome those specific things, work on them for the long term so that they have long-term success. So an example of this would be someone who's not getting adequate sleep. We know from lots of research that not getting adequate sleep can affect your overall health and can affect your weight, both with weight gain and inability to lose weight. So we'd work with that individual to make sure that they have good sleep hygiene, also look at other contributing factors that could be affecting their sleep so that that's no longer a roadblock to their success. Another example of this would be someone who has a lot of stress. They have just a high stress lifestyle. So we might recommend working with a counselor to learn stress management techniques, learning cardiac coherence, which is an amazing skill to have on hand. Working with them to carve out a few minutes in their day for meditation. Those are just a few things that can really help with long-term stress management, which can affect long-term weight management, and that type of thing. I think it's important for everyone to realize that weight loss, kind of like you mentioned earlier, Sita, is very multifactorial. We need to address it from a whole person perspective, mind, body, and spiritual, and take all those contributing factors that could be contributing to your weight gain, weight loss, that type of journey to set you up for long-term success.
Yeah, absolutely. And I think that we kind of overlook sleep. Why would that be at all related to weight gain or weight loss? And so I'm really happy that you mentioned weight. I think also, individuals who do have excessive weight, they can have actually disordered sleep as well. And so that's, again, one of the reasons why I think it's really important to be working with medical professionals who can be monitoring all of these other things that could be contributing without even knowing about it. And then just giving you the overall success and being protective for your health and helping you all together. So along, Christy, one of the biggest things that people are starting to see is that when you are losing weight, you're starting to have sagging skin and you're, kind of skin tightening. What are we really doing? What are our recommendations around skin tightening as it relates to kind of rapid or faster weight loss?
Yes. I often do see this as a concern for some patients that we work with. And thankfully, there are ways to maintain skin tightness. Kind of going back to my point earlier, those who lose weight rapidly do struggle the most with loose skin. So another reason to have slow, steady weight loss, because that allows the skin elasticity to keep up. But a few things that you can incorporate to help maintain that skin tightness. And one of those is incorporating strength and resistance training. So here at Palm, we have amazing personal trainers that will work with you and meet you at your activity level. They can also create a personalized exercise plan specific for you. So they'll meet you where you are at, create a plan for you, and someone that you can work with for accountability in incorporating more weight training. So that's one way. Another way to maintain that skin tightness is incorporate dry brushing. So dry brushing is a great tool for skin and helps to maintain that tightness and tones the skin by increasing the blood flow of the skin's outer layers. So this increased circulation helps to lessen the appearance of cellulite, which is great. And we do sell the dry brushes in the atrium here at Palm if you're interested. If you have more questions about dry brushing, we would all be happy to answer that. But that's a great tool you could do. Typically before the shower is a great time to do that, and gets kind of the dead skin off as well, which is another benefit. And then lastly, collagen helps to maintain that skin tightness. So this is a great product that you can incorporate into your supplement routine. And just to tell you a little bit about collagen, collagen does account for roughly 30% of your body's protein. It provides the structure, support, and strength to your skin, to your muscles, bones, connective tissues, a lot of different areas in the body. But collagen in the skin, it helps maintain that elasticity because it does work with hyaluronic acid and elastin, which helps to maintain that volume and moisture and plumpness of the skin. And it can help maintain that tightness and prevent the sagging skin. So we have a variety of different collagen supplements here at Palm that are either sourced from marine fish or variety of different marine life, and then also land animals as well. So we have 3 great options. All of these are third-party certified, and all of our supplements here at Palm are third-party certified. So you can incorporate one of those into your routine, and that can also help to maintain that skin tightness.
Yeah, I think that it's it seems like such a thing that people shouldn't have to worry about, but it's such a common question that's coming up. And I do think it's important for us to be thinking about the whole body from the inside to the outside. And so as we're putting individuals through the medical weight loss program, I think it is important to almost be preventative. Don't wait until you start to develop that problem. So start to incorporate the collagen, depending on what you want. And Christaney, you do nutrition supplement consults, which I love because you have become kind of an expert within Palm for our supplements. And so if you don't know which collagen to use, definitely consult with Christaney to help you figure out what might be the best. I think the other thing that I like to always mention is your skin will have a place where it'll kind of catch up. And so it might take months or even years to catch up, but it will catch up. It's just how can we promote it to do it a little bit more robustly. And then a little plug that we have for our sister organization, Origin Wellness. So they have this amazing technology called Body Tone, and it's using a mechanical stimulation of the collagen. So they use suction and kind of rolling technique with this device, and radio frequency and infrared to help with collagen stimulation, circulation, lymphatic drainage. And they can target areas, but they'll work with you. And if you can do that once a week while kind of doing weight loss, that is another thing that will be helpful. So I'll have a slide at the very end that gives the contact information for Origin Wellness, which is near the SLU campus downtown. And I think it's important to remember there's lots of different modalities that we can use. So I wanted to take a moment to really just see kind of what are your final advice that you have for individuals. So Katie, if you don't mind starting, is, people are going through this journey. What's your advice for them as you get them going and as you support them throughout this process?
Yeah. Just to start off, I think it's really important to recognize that every person's journey with weight loss is personal and unique. Everyone has experienced different things, has their own relationship with their journey. And I think it's important for all of us to acknowledge that so that we can support each individual specifically to them that's going to be most beneficial for them and their journey. It's like with that in mind, not one plan fits all type of style. Our plans and the way we treat our patients are very unique and personalized. So just remember while you're going through this type of weight loss journey is that your journey is not going to look like someone else's. What we might recommend for you is not going to be what we recommend for someone else. And there's a reason for that. And that's really what you want in the long term anyway, is something that's going to support you as an individual. I also think it's important to remember not to solely rely on medications when it comes to sustainable weight loss. Medications obviously are a wonderful tool that we have, but we also have to remember to implement long-term lifestyle changes. Like we talked about already, diet, exercise, stress management, healthy sleep, toxin reduction, all those types of things that, we would work with you in your journey to ensure that those lifestyle modifications are all in place. But it's just something to remember. It's not just one little thing that you're going to be working on. It's a whole modality, lots of different modalities you're going to be working on to make sure those types of things are solidified for long-term success. So that's kind of my overarching advice. But Christaney, I'd love to hear what you have to say.
Yes, great. So going along with what you explained, Katie, these weight loss medications are a great tool to help support a healthy weight. But it is important to initiate those positive diet and lifestyle changes while taking the medication, because this will support your internal health and prevent weight gain once you get off the medication. So our team will support you every step of the way and help find realistic ways to decrease your stress, improve nutrition, achieve your fitness goals and other health goals that you may have. So our medical weight loss team will work as your accountability partner and support you to succeed. We want you to succeed and have a life of vitality and longevity.
Yeah, absolutely. I think that these are really inspirational as well. And, I think that it's kind of going back to the very beginning. We know losing weight is difficult. We know that individuals who are interested in losing weight have probably, really struggled with their weight for years. This is not something that just started overnight. And we know that individuals are trying, and they've tried something in the past that may have helped, and they might be right back where they are again. And so these common challenges, you're not alone. And we want to create a community here at Palm and a support team to really help you find that hope and success again, and to do it safely and to help you not be on the medications long term. That's really our goal. So I hope that individuals have found this to be helpful. I really appreciate Christaney and Katie, your time today. And I know that we're all really excited about the possibilities. And this is definitely the very beginning of this, I think, this part of the medical field. And I appreciate your guys' time today and your efforts with all of our patients.